Hello, everybody. This is Dr. Mayorga, and a couple of days ago, I did a video called The Blame Game. And then I said that I would go ahead and do another video on what we call vicarious trauma, which happens when someone is exposed to stress or trauma. They're not experiencing it. It's like a second hand. And I thought about that, especially with what's going on in Kerrville and what has happened in other parts of the United States, because we've had a lot of catastrophes, tornadoes, hurricanes, flooding, and it just seems to occur one right after the other. And there people that normally experience vicarious trauma are people that are responding. So, definitely first responders, firemen, police officers, sheriffs, volunteers. I actually, a couple of years ago, wrote an article on vicarious trauma and compassion fatigue for school counselors because there was a time, I'm not saying it's still not occurring, where there was a tremendous amount of violence occurring on school campuses where people were coming on to the school campus and uh, killing people. And I try to be very cognizant of, what I talk about and how I present it, because it can be very traumatic for someone that has experienced something like this or has experienced a loss of a loved one through this kind of catastrophes. So I wanted to do a video and talk a little bit about vicarious trauma and what the definition is, what we need to be aware of. Because right now, with all the people that are helping, all the people that saw what happened in Kerrville and up in the hill country, it wasn't just Kerrville, it was in Comfort, and it happened in Georgetown, Burnett, San Saba, Llano, all of that area up there experienced tremendous flooding. So there were a lot of people that watched and saw and couldn't do anything. And so this is my reason for doing this little video. And like I said, I have another video, another topic that I will be recording called Survivor's Guilt. And again, there will be people experiencing something like that. But I don't want to talk about that right now because it's a whole other topic. I want to devote time right now to defining what vicarious trauma is, and it's called secondary traumatic stress because you're not experiencing the catastrophe yourself. You're not in the middle of it, but you are observing it, or you've seen it, or you've heard about it. Uh, let's give you an example. I mean, right now the news media is flooding the social media, the newscasters with constant information about what's happening, update after update after update. Anybody watching that constantly could experience some vicarious trauma. And like I said, I used the example of school counselors who talk to the students that have experienced the catastrophe or the event. And so they will experience vicarious trauma or compassion fatigue. Nurses, doctors, first responders, anybody that is volunteering or helping day after day. We're into the seventh day of what happened in Kerrville. It's a lot of exposure of seeing what the devastation. Okay, so secondary traumatic stress or compassion fatigue, and it's described as emotional residue of exposure to traumatic stories and experiences of others. Even reporters who go up there. I think about, I'm old enough to remember Vietnam War and all the reporters that would be embedded, or they've been embedded in Afghanistan, Kuwait, all of those. They were there, and they would speak to our soldiers, and they hear the stories repeated over and over again. They could also experience vicarious trauma. And how does it develop? It develops by just like what I said. You're observing, you're watching, you're hearing, you're witnessing. You may be a bystander and you're witnessing. There are some people that witnessed a lot of situations during the flood and they couldn't do anything about it. Right? Uh, and one of the things that it reiterates in my research about vicarious trauma, it's something that I'm very interested in, is that it changes our worldview, either positive or negatively. Let me give you an example right now with what's going on in Kerrville. There's a tremendous amount of people that are out there helping. And maybe somebody there had a negative view about the world and what's going on. Then all of a sudden they see so many people just pouring out love, compassion, help, being there, and it'll shift their worldview. So it can shift their worldview emotionally. They also, it shifts your emotional ability to regulate your emotions. It might, and I'm going to talk about that, where you might have been a steadfast kind of person, all of a sudden you're uneasy all the time, and it affects your overall well being. You're going to be traumatized. And a lot of people don't recognize that they're traumatized, so therefore they're not aware and they just keep going. And eventually something will stop them. And so how it affects your well being because we just think, well, we're strong enough, we'll just keep going. Let me take a deep breath, let me keep going. I'm doing okay. That's one word that's always overused, or a little statement that's overused. People come up, how are you doing? I'm okay. Well, you're not sometimes okay. I think I did a video on happiness and joy or the difference. And people that say, well, I'm happy all the time. No, not really. It's the same thing like saying that you're okay when you're not. Yesterday, I was talking to somebody and they just had a loss. And I said, let me know if you need anything. And she said, okay. And then she thought about it. And she said, well, let me tell you, this is what's happening. And she asked for help. I don't know. I think one of the hardest things for us as human beings is to ask for help. We're not taught to do that the majority of the time. Uh, we're taught to be stoic. You can do it. Um, get a grip. You ever hear that? Get a grip. You know, stop being such a crybaby, or stop. But when you're experiencing vicarious trauma, you need to really think about letting people know that you're experiencing this. One of the things about vicarious trauma is that it's not directly trauma that you've experienced. Again, it's called non-direct trauma. And you are experiencing the trauma because you're hearing it all the time or you're seeing it, and it's creating emotional upheaval inside of you, and you don't know what to do with it, or you're not even cognizant that by doing all of this, just think of the first responders. And I've talked about this before earlier when I did the video on the blame game. You've got to put your emotions aside. You can't really think. You have to be focused because you're in the middle of trying to do something to help others. And then afterwards, you might continue on that track and not recognize that you're experiencing vicarious trauma. It does have an emotional and psychological impact. I don't, there's no two ways about it. It will impact you. And here are some of the symptoms that you can experience. Intrusive thoughts. Maybe you go home after a full day of helping, or maybe you've been a first responder for a long time. I think about 9/11. I went up there and, at when they built the memorial, and I walked through the buildings that the first responders would come and rest while they were working, and a lot of emotion that I experienced by just seeing everything, pictures, and where they would come and sleep, where they would eat, and it was overwhelming for me. Okay? So there's a whole bunch of emotions that run through somebody that is experiencing vicarious trauma. One of them is intrusive thoughts. One of the things that's hard for people that volunteer or first responders is they don't want to rest. They want to go back out there. If they go and rest and eat, okay, that's enough. I got to go back out there because they're thinking about what they need to do or what they saw, or somebody out there might be found, or they need their help. They might begin to have nightmares. Now, one of the things I want to reiterate here is vicarious trauma. It doesn't have a DSM-5 diagnosis. For those of you who know about a DSM-5 diagnosis, that's the book that psychiatrists and counselors and psychologists use to determine if there's a mental health disorder. So vicarious trauma does not have a DSM-5 diagnosis, but it has a lot of the symptoms that somebody with PTSD would experience: intrusive thoughts, nightmares, anxiety, depression, difficulty concentrating. You all of a sudden you can't remember what you wanted to say, or your thoughts can get very confusing. And again, one thing that they reiterate over and over again is this change in worldview. You're either going to become you're either going to begin to see that people really are compassionate and do care, or you're going to become cynical. You're just going to say, life in this world is so horrible. How could this happen? How could all of this happen to so many people? And all of a sudden, you become negative, you become pessimistic. And so, again, there's a shift in worldview one way or the other. Okay? It can also impact a person professionally and personally. You need to be able to establish boundaries. You ever hear of those people they bring their work home? Let's talk about counselors. I teach. I'm an educator. I teach people who are wanting to become counselors, and we talk about that, especially at the very beginning. You're seeing clients, and you bring your work home, and you're at home, not unable to participate in your own home environment because you're thinking about the client that came in and told you all these things, and what are you going to do? And so the client may not be there present with you, but they are there present with you, and you're using your energy, and there's no boundaries. uh, Instead of leaving it here at work, you've brought it home. So first responders have difficulty with that. And I'm talking about, when I say first responders, I'm talking about anybody that happens to work with people in situations that could be catastrophic. Again, I use the example of school counselors because I wrote an article, I did a survey, I did research, and turns out they have a lot of vicarious trauma and compassion fatigue. And doctors, especially in the emergency rooms, or doctors that do the kind of traumatic, really strong, they're doing cardiac work, that they're doing that for 8, 10 hours. I used to work for an ear, nose, and throat surgeon. Sometimes we'd have clients that came in with very serious situations where they had a tumor that needed to be excised, and it was going to be a 10-hour situation because maybe it was a thyroid tumor that had fallen into the chest. So we'd have to have a cardiologist available to open the chest so we could pull the tumor out. And so if you've got days and days of doing that kind of work all the time, then you're going to have vicarious trauma. You're listening to the family, they're talking about what's going on. So anybody that has that kind of employment, they could experience vicarious trauma. Okay. So again, maintaining boundaries. And if you don't do that, you don't take care of yourself, if you don't know how to separate, it's going to impact all your relationships. Whether you're married, not married, have a significant other, family members, because family members and others can see what's occurring, and they'll try to tell you, and you'll just say, "Oh, no, there's nothing wrong. I'm okay." Again, that comment, "I'm okay." Uh, when somebody keeps saying, "I'm okay," and you're having to ask if they're okay because you see something, then their chances are that they're not able or willing to acknowledge that they're not doing as well as they say that they are. Okay. So again, There's also a group of people or people that might tend to be more susceptible to vicarious trauma. People who are highly empathic, they have high levels of empathy, they feel the pain of somebody else. They feel what that person is going through, and they're more apt to experience of the vicarious trauma because the emotion overwhelms them. Okay? If they don't have good coping skills, I know that I'm being affected by what I'm seeing. I think I need to take a breather. I'm going to step outside, or I'm going to take a few days off, or something. There's a coping mechanism in place when they use when they recognize that they're being overwhelmed. For example, turning off the TV and not watching the news 24/7 about what's going on, and an update and an update and an update. I remember the flooding that happened in North Carolina, and what's happened in Kerrville. I remember the flood that happened in 1987 where the young people in the bus, and there was another flood in Wimberley. That was also catastrophic. I've been through hurricanes. And so there's this constant update, update, update. And most people, you pick up your phone, go to Facebook, it's there. So learning to turn things off for a period of time so that you can give your brain, your body, your mind, your emotions an opportunity to rest. Uh, and lack of support. You're not talking to anybody. You're carrying it all by yourself. Nobody is, or when they do want to offer you support, you don't want it. You just want to disregard it and keep going forward. A lot of people that are doing the kind of work that's occurring right now do need to think about becoming part of a group for a couple of weeks because it's all about processing. You can go to a group every day for about 10 days, and it'll be so much better and it'll help you recuperate that much faster than if you wait 6 months before you decide that you need to go do something. Okay. So, again, symptoms of vicarious trauma: intrusive thoughts, avoidance. Somebody start a conversation about something catastrophic, you avoid it. You walk out. You don't want to hear it. You tell them to stop talking. Okay? Emotional numbness. You just put your feelings away so that you can exist because the feelings are so overwhelming. Uh, Hyperarousal, anxiety, poor sleeping patterns, feeling on edge all the time, like something's going to happen, or you don't want to go do anything now because what if? What if we're there and something like that was to happen? Okay? Again, they use this over and over again. Changes in your worldview. You're either going to be more optimistic that there is goodness in the world, that when something happens, people come together, or you might go in the opposite direction and just say, well, the world is horrible and nobody cares. And how could God? And whatever might come out of that person's mouth. And prior to that, they would say things differently than they're having um, a change in their worldview. Okay. And then again, burnout and compassion fatigue. It happens a lot. Would you be you'd be surprised that we as counselors who are there to help people, we have the highest rate of burnout and compassion fatigue. So it's important that we go ahead and recognize all of this. And I see right now that there's a lot of counselors offering free help, free time for people to go for some sessions that are, I would call them processing. And you don't necessarily, you're just going to be focused on what's going on right now. You don't have to sit there and give them your whole life story. It's about an opportunity to de decompress or debrief. It's another better word for it. It's very important that responders have an ability to debrief as quickly as possible rather than holding on to and not having an opportunity until 6 weeks later or something like that. So, anyway, as a counselor, I think about these things, and I've said this before. These are things that are close to my heart. I've been a counselor for almost 25 years. I've been a counselor educator for 20. I've done a lot of presentations on this types of topics, and I just think this is my way of giving back to the world or society or people in need, So that is why I do these videos. And I hope you take the time to listen to them. And may you all have a good day. And think about if you are a person that is helping in these situations, that you gift yourself the time to go see someone, get part, become part of a group, seek help, seek support, and recognize the symptoms if these are occurring, that you could very well be having vicarious trauma, and that you're important to other people, and taking care of yourself is one way of demonstrating that. Thank you.